You're watching a special edition of the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, who's a candidate for dental implants? If you are wearing dentures or missing any teeth, my advice, stick around for the latest edition of the Wellness Hour.
The Wellness Hour, an in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You are watching the latest edition of the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. My first guest is Dr. David Greenlee. We've invited Dr. Greenlee on the program today to discuss who's a candidate for dental implants. Dr. Greenlee, welcome to the program.
Hello, Randy. Thank you for inviting me.
Now, before we get into today's topic, tell us a little bit about your practice.
Well, I've practiced in Raleigh. I've practiced there for 20 years. I have a general practice, provide all phases of dentistry. I see patients from 2 years old to 102.
Okay.
And I'm very privileged to work with a wonderful staff. It's a very dedicated and caring group of individuals. And we've got a wonderful family of patients. Really enjoy going to work. Feels like I'm seeing old friends almost every day.
Is that right?
So, yeah,
old
it's really
friends.
Nice.
Now, dental implants. We've invited you on the program today to discuss this topic. How long have you been doing dental implants?
Well, I've been involved with dental implants really for the entire 20 years. The office or the practice I took over for, Dr. Richard Hunter, was placing dental implants. So I have been working with dental implants really for 20 years. Over the years, they've become an increasingly big part of our practice and become really a very routine part of dentistry today.
So who's a candidate for dental implants?
Well, really anyone that's missing a tooth, from a single tooth to maybe they've worn dentures for 20 years. Anyone with a missing tooth could be a candidate.
Okay, now you both place the implant or do the surgery.
Correct.
And also put the cap or crown on top, is that right? Tell me about that process.
Well, there's sort of the two phases. The first is involved with putting the implant in the bone so that it becomes fused to the jawbone, becomes part of the jawbone. That's the first phase, and then the second phase is putting the tooth on it. And depending on the needs or the circumstances of the patient, that may be a single tooth, or it may be several teeth, or it may be the entire arch of teeth.
Okay, now anticipating this interview, I understand that's not how it's always done. Normally there's two people involved.
Well, typically, a surgeon of some sort, a periodontist or an oral surgeon, would typically place the dental implant, and then another dentist, the restorative dentist, would provide the teeth that go on.
Okay.
So it has in the past traditionally been a two-step process.
So you've had specialized training in placing the implant?
Yes, absolutely. I've studied at the Misch Implant Institute, which is under the leadership of a dentist named Dr. Carl Misch, who is probably the leading expert in dental implants throughout the world. And I've studied extensively there.
So this is your focus, though, dental implants, of all the areas of dentistry.
Correct.
Is that right?
Well, we provide a comprehensive services of dentistry, and implants is becoming an increasingly large part of that.
Okay, now how big of a problem, by the way? Because I guess denture wearers are the ideal candidates for dental implants. But how big of a problem is this?
Well, it's huge. If you're wearing a denture and you're uncomfortable with that denture, the denture slides, moves around, you're not confident in that, it has all kinds of implications for your daily life. Just going out to eat with friends is something that you're intimidated about or very uncomfortable about. So if you're not able to eat, think about all the activities, all the family gatherings, the things that we do in our daily lives. Food is involved, and so if you're unsecure about just sitting down and eating in front of other people, that's a huge problem. Okay,
now you don't need a lot of dental implants, I guess, to give somebody a, for the denture wear.
It varies on the situation, but a lot of times even 2 implants can make a big difference.
To secure a denture?
We like to have more. There's more stability, but it can be done with 2. And the idea there is you use dental implants to anchor that denture in some way so that when you put that denture in, it literally snaps onto those implants and is held securely in the mouth. No more sliding around, no more problems.
Now, we've talked a little bit on the phone prior to this interview, and you said that if the denture wearer knew what they were missing with dental implants, that they would all do it.
Oh, yeah.
I mean, is that accurate?
Oh, without a doubt. The problem is with the denture wear, a lot of times a patient gets into that position, they're for whatever reason have come to this point in their dental health, and that becomes only the real option that they've had. Now that may have been 5 years ago, may have been 30 years ago, but once you have the denture, your ability to chew is dramatically decreased the day you have dentures. It's about 25% of the ability to chew with natural teeth. And then over the years, you start to have a even less ability to chew because your jawbone is sort of slowly melting away. And those dentures are sort of going down into the bone, and you
So the bone goes away.
The bone is melting away. That is true. Once
Just because there's no pressure of the teeth on there?
Well,
why is that?
Because the teeth are not there. The teeth or the bone is there to anchor the teeth. And so once the teeth are gone, there's no function for the bone. There's no purpose for the bone.
Okay.
And so the body just starts to slowly resorb that away. And that's a continual process.
I see that sunk in look, by the way, with denture wearers. That's where I feel like I could spot them.
Exactly. And that's very true. And that's something that happens, it gets worse over time. As that jawbone's melting away, those dentures are settling in, and as that patient bites together, the nose and the chin start getting closer together.
Interesting.
And that's how you get this sort of the elderly look, premature aging, a lot more wrinkles around the lip and mouth area.
So implants have become very popular nationwide. I mean, is this the new so-called gold standard, if you will, when somebody's missing a tooth?
I would say it's definitely the treatment of choice when you're missing a tooth. It's really, it gives you your tooth back.
Okay.
It puts a tooth back. So instead of going with some other remedy that is a compromise, you're able to go back where you actually have your tooth back again. It's fantastic.
What are the different categories of patients you're seeing in your practice for dental implants?
Really anyone that's missing a tooth.
Okay.
That could be a single tooth, someone that's maybe born without the tooth or lost the tooth for whatever reason, to someone that's missing several teeth, to someone who's maybe been to the dentist and has been told that they're going to lose all their teeth and that they're facing dentures. So in that case, the implants become a good option. Also the patient that's worn dentures, maybe for whatever number of years, dental implants can still be a very good solution for them.
Can you be too old for dental implants?
I don't think so.
Is that right?
I recently placed an implant on a woman that's 91.
Now, why would a 91-year-old want to get a dental implant?
Well, she wants to chew. She wants a life, and
Okay.
It was visible. She was not going to tolerate a missing space, and even though she's 91, she's still very active, very healthy, and has several years ahead of her.
Now, how does she hear about you? She was already a patient?
Regular patient. She
Okay.
was one of our patients who, just in the course of things, the old dentistry broke down.
So
And
nowadays, if you're missing a tooth, is it a standard where each patient is supposed to be offered a dental implant as an option?
I would certainly say so. It is certainly one of the options, and that's what
Because
I
I've
like
met
to.
people going into this interview that say, I was never told about dental implants.
Well, I would hope that's not happening anymore.
Okay.
I think it should be the case. It should be certainly one of the options that's offered to patients. My point of view is if you are faced with possibly losing a tooth, you need to be informed of the variety of things that can be done.
Okay.
And so we like to lay out a variety of choices for the patient and help them to choose what's right for them.
So it's not just all about implants if I go to your office.
Oh, certainly not.
Okay.
It's one of the various dental procedures that we offer.
Now, going into this interview, driving over, I'm talking to my mother. She's 74 years old. And I told her I was interviewing you. And she has been wearing dentures since she was 28 years old. And she says, I'm way too old and too unhealthy for dental implants.
No. And you said 74?
74.
And that is one of the things that I see a lot of is that's a very, very typical situation. Someone that maybe is in their 70s, they start thinking, I'm too old for this. Why should I?
They self-diagnose.
Well, and they don't want to, they think they shouldn't invest the time and energy and money into getting this situation taken care of. The problem is that when I see that happen, then that patient, we see them over the years, 5, 10 years go by, now they're in their 80s.
Okay.
Their problem's gotten worse, and they're suffering more and more with it. The dentures that they've been wearing are fitting worse. They're having more and more trouble trying to chew and talk, and just wearing the dentures is uncomfortable.
Is that a big problem? Because I know a few people with dentures. I don't hear that they're complaining about that they're loose or falling out when they're laughing, things like that.
You know,
Are these the things they tell you?
Yes, it takes a little while. It has to be brought out a little bit. They don't like to sort of dwell on those sorts of things. But one of the things, if you're watching television, look at how many denture adhesive ads you're going to see. They're everywhere. That means there's a problem. They wouldn't be selling all this polygrip if there weren't loose dentures out there.
Yeah. So they're becoming loose. So I get this, understand this correctly, because the bone is going away, or resorbing.
Bone is resorbing, correct.
Okay.
And so that's a very slow, gradual process. The denture slowly starts to sort of loosen up, and it's something that happens so gradually that a lot of times the patient becomes used to it. They forget sort of really what it was like to chew. They forget how much of a disability they have.
Then why isn't everyone getting dental implants? Is it just the expense they're worried about?
Well, it's I don't know. I think it's an excellent choice, and from what I've seen, anytime a patient has become aware of the benefit of the dental implant, they'll look at that and say, that is definitely the best way to go.
I mean, in the long run, I mean, with everything that you guys do, the dentist, I'm sorry, respectfully, to save a tooth, seems like giving somebody their tooth back with a dental implant is a lot less expensive.
And
I mean, is that true?
In the long run, that is very true. The reason for that is that even once you have a single crown on a tooth, that's not the only investment. That crown is the initial investment, but when you look at the cost of the dentistry to upkeep that crown over the course of one's life, it becomes huge and actually far more expensive than a dental implant.
We're going to take a quick break and talk more about the denture wear, what you can do and what their options are. You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, who's a candidate for dental implants? We'll be right back.
There's a new secret to looking younger, an advancement so profound it took a team of scientists years to create. A time machine called Zoom. Getting zoomed is the fastest way to erase years from your looks. Zoom is the most advanced teeth whitening ever. Only your dentist has it. Nothing works like it. Zoom Gel gently penetrates the submicron pores of tooth enamel. The patented Zoom Light superactivates the gel through a unique photofenton reaction, breaking down the stain's double bonds. In just 45 minutes, years of discoloration disappear, transforming your smile to wow. To find a Zoom dentist near you, go to zoomnow.com or call 800-891-4895. For your whitest, most confident, most irresistible smile, get zoomed today. Make your appointment at zoomnow.com or call 800-891-4895 today and discover the wow of Zoom.
Tried all sorts of cover-ups for bad breath? Try the science of BreatherX. Only BreatherX has Zytex. It attacks the cause of bad breath, keeps working for hours. It's clinically proven for real fresh breath.
Get non-prescription BreatherX from your dental hygienist and now at fine stores everywhere.
You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, who's a candidate for dental implants? With us, we have Dr. Greenlee. Okay, we've talked about the single tooth dental implants, some of the advantages. What about somebody that goes to their dentist and they're saying, okay, your teeth have to go? I mean, are these people that, what do you tell them? Because they have to think about dentures, I guess, or?
Right. And that can be an extremely emotional event, Randy. You may not understand that, but I've sat with patients and counseled them that very thing, that we've come to the conclusion that they just have to lose these teeth. And it's traumatic. It is emotionally very traumatic for these folks.
Isn't that common, by the way, people? As a dentist, that you say your teeth have to go?
Well, it's becoming less common.
Okay.
Dentistry as a profession is saving more and more teeth, and that's a wonderful thing.
Okay.
But it still happens. It still does happen. And for those patients, that hope of an implant, of being able to go back and put a tooth back there and avoid that denture, it gives them some hope, and it helps them to emotionally avoid the trauma of losing all those teeth.
You say it raises self-esteem.
Oh, absolutely.
How so?
Well, if you try to put yourself in a situation where you are self-conscious in a public situation.
Okay.
Self-conscious about smiling, self-conscious about eating, self-conscious about meeting a new person and smiling.
Because of the dentures?
Because of dentures, because they're loose, because they're uncomfortable. They may not look natural, they may not feel comfortable, and they may be scared to eat.
Okay.
And afraid to bite and chew in a public situation because their denture is going to slip or slide, or they're going to have problems.
Interesting. They become less social?
Oh, definitely. And they make up excuses. Family may not know why they're not going to come to that event. They may say they don't feel well.
Really? Just because of their dentures?
But the reality is they
like
are
eating events they stay away from.
Exactly.
Interesting.
So many of our social situations, weddings, all those sorts of family gatherings, holidays, it all involves a meal. and if they're uncomfortable eating in front of other people, they're gonna decline. They're gonna tend to stay
After
in.
they get their implants, do they say, doctor?
Oh, it changes their life. I mean, this allows them to get out and to socialize again, to be confident in their appearance, confident in their ability to chew and eat.
Now,
it's life-changing.
In dentistry, I mean, nobody likes going to the dentist, I don't think.
I haven't run into anybody yet.
Okay, but is this the happiest group of patients, the dental implant patients?
To take a person that's had dentures and to go back and give them some implants, either to restore all of their teeth and give them another fixed set, or where we restore and give them a denture that snaps onto a bar that is 100% secure, it's huge, and they are so appreciative of the difference that it makes in their life.
Okay, so cleaning up old dentistry in their mouth, old, maybe they're missing 4 or 5 teeth in the back. This is an easy one.
Yeah, oh, this is fantastic. You can take that section, you put in implants where you're missing teeth, put new teeth on there, and it's
cleaner too.
Oh, much cleaner. You're able to clean and brush just naturally. It's just like normal teeth.
Okay, the denture wear. Let's start there. Upper and lower denture. Tell me about the upper denture.
Well, upper denture, people usually do reasonably well with that, particularly if they have a good ridge. But a big problem for a lot of folks is that the entire palate is covered with the denture. That's what helps makes it more stable, but it also alters your taste. It diminishes your ability to taste and get the flavor out of food. And just that contact against the roof of the mouth, for some people, that is just really bothersome.
Okay, so the denture covers the roof. Okay, interesting. I didn't think about it.
Yeah, covers the roof of the mouth, and can make some people feel like they're gagging or choking and stuff. And just for some folks, it's very uncomfortable. The implants can be done and allow that to open up. It's secured by the implants, so you don't need that coverage up against the roof of the mouth. So for the upper
denture wear, how many implants do you need to secure? What, a snap-in, snap-out?
A snap-in denture. Typically, you want to have a minimum of 4. It's nice to have more if you can. It's more secure. And then you're able to create a situation that's much better.
What if somebody wants something that's permanent for the upper?
Well, then you're looking at typically a minimum of about 8 implants. And once you've got 8 implants, you're able to provide a full arch of teeth, permanently fixed in place. Looks natural. They don't come out. That's the difference. Is those teeth stay in. It
sounds like that's what people would want, though.
Absolutely, and it is certainly the best way to go. It is ideal, but you do need more implants, and so you get in sometimes where the bone is a critical issue. Do you have enough bone to put 8 implants in there?
Now, I heard a story that married guy, his new wife, 2 years, doesn't know that he's wearing dentures. Is that common? I mean, you hear stories like that. They hide it.
Yeah, more than you would think that people will hide that from their spouse. It's not uncommon, and definitely. And one of the things that dentists, we like patients to take out their dentures at night. If they have regular dentures or partials, those need to come out at night, lest the gum tissue rest. That's best for the gum tissue. 80% of people don't take them out at night because they don't want to go to bed with that spouse.
Is that right?
And have their teeth, they take out their dentures, and what happens? Your lips fall all in, and you age 40 years right in front of you, and so people don't want to do that. So consequently, they don't take them out, and then the bone resorption continues at a faster rate because they're wearing their dentures 24 hours a day, and there's a lot of pressure on that bone, and so they end up with problems progressing.
Take me through the process. Patient goes to you, they're wearing upper and lower dentures, and they want to know their options. What are the frequently asked questions you get?
Well, is it going to hurt?
Yeah, good question.
And the placement of the implant is totally comfortable. Everything is totally numbed, and there are a variety of ways to keep a patient comfortable, from nitrous oxide gas to various sedation techniques. But the placement of the implant, absolutely comfortable procedure. Some minor soreness in the gum afterwards, but most of our patients really don't even need pain medication. They get.
Is that right? No pain medication?
Well, typically not. Very little. Just for a couple of days, some gum.
So you're
soreness.
placing, and this is a titanium post that goes
into the jawbone, and it's a titanium root.
Do they walk out with some type of a cap on the tooth?
Depends on the situation. That is possible in certain situations. Depends once again on the bone and various other factors. There's always something there. They don't have to go home with a missing space. And so we were able to temporize that in some way, shape, or form so that they're always aesthetically taken care of.
Now, I interrupted you, and I was asking about the frequently asked questions. Okay, so they're worried about pain. What else?
Expense, that's always an issue. Longevity, how long is this going to last? And a lot of times people will say, you know, I wonder if I should do this at my age. And that's something that I see a lot.
So what do you say to somebody watching this? They're in their 70s.
Mm-hmm.
People are living longer today.
Definitely.
What do you say to them?
Well, and I'd say exactly that. People are living longer, and the problem is that if they don't address that dental problem at 70, the problem is going to be worse at 80. It's going to be worse at 85.
Because why? Why?
Well, these problems are progressive. And
I mean, less bone?
Less bone. Once you lose a root or all your teeth, that bone is continuing to resorb away or melt away over
So
time.
the force of the implant allows you to keep bone?
Correct. The implant being in the bone, then the bone now has a function. The bone is holding the implant.
Okay.
And that's what bone needs to be functional. If there's no function on the bone, then the body resorbs it away. So by placing the implant in the bone, it preserves the bone. So it's going to hold the bone where it is at that point in time. That's why it's so important to do it as early as possible, because then you save as much bone as possible. And I've seen patients that have, you know, said, oh, I'm too old, I don't want to do this. And so as they get older, the problem gets worse. And then when they realize I have to do something now, the problem is bigger.
So is it all about chewing, though?
Well, it's about
Can they
that's a
chew
big part
better,
of
I
it.
guess?
Oh yeah, that's a big part of it. When you have something that's solid and secure in your jawbone, you're able to eat what you want. They can go back to eating an apple. They can go back to eating corn on the cob, whatever they want.
Okay, now you brought some models. What are we looking at here?
Well, this is just a model of a lower denture. So in here you have 5 implants placed in the jawbone, and then a bar that is fastened securely to those implants.
Okay, and that just snaps right on there.
Right. Then the denture is made with clips inside the denture that fit the bar, and so it goes over and snaps in. The bar part stays in the patient. That's fixed to the jaw.
It's tough to get out of there.
And it is a little, there we go. But this part stays in. It's secured by the implants. So there's 5 implants in here.
Is that easy to take out?
Well, there are times when some of our older female patients, it is a little bit tough. We actually have to loosen this up so they can get it out.
Okay.
So that's the biggest problem we have, is making it loose enough they can get it out. But when you put this in, there are clips inside the denture that fit over the bar, goes into place, and then it snaps on. And once that's in the mouth, then this is a solid. It is solid to the jawbone.
It seems like every denture wearer would want to do this.
Well, I would certainly agree with that, and I think once they're aware of it, they may not know that this is a valid option for them.
I mean, is that common? Somebody saying, "Wow, I didn't know that you can do that. I thought it was all or nothing." In fact, going into this, I thought, okay, you know, 20-something teeth. How many teeth are there, by the way?
Well, 32 counting wisdom teeth.
Okay.
Typically, most people have 28.
I mean, are there cases where people get all their teeth back?
Uh-huh.
Is that right?
Yep. You can do this where instead of the bar and a denture that snaps on, you have an arch of teeth that is permanently attached to that bar. That's something that doesn't come in and out. You can do that upper and lower, and essentially you get a 3rd set of teeth.
Okay. Now you make these dentures. Do they get a new set of dentures? Do you make their current dentures work with these snaps?
You can. Typically, by the time we see the patient, the old denture is worn out, doesn't fit very well, so most of the time we need to make a new one. Now, if for some reason someone has a new denture that's otherwise in good shape and fitting well, it can be fitted to the bar, kind of a retrofit, and that is possible.
Now, we're just about out of time, but I mean, what should somebody look for in a dentist? I guess because any dentist can do this. Is that right?
Well, right.
I mean, you went to the Misch Institute.
Correct.
I've been told this is the premier place to learn.
In my opinion,
implant
it
dentistry.
is certainly the world-renowned place for implant training.
Okay.
And I would look for someone that has been trained and by an independent source such as the Misch Institute. A lot of our training is manufacturer-driven. In other words, a brand of implant. They'll give you a one-day training, sell you their implant, and people are often running placing their implant after 1 day of some instruction. And that to me is just not adequate. You don't know what kind of problems you're going to get into, and you don't have a full comprehensive training to really handle that.
So you've gone through several courses then?
Many courses.
Over years?
Over years, correct.
On implant. Placing?
Placing and
in the bone,
the restorative part of it.
Okay. What are the fears people have? Because not everybody's doing this, obviously. Is it just what we've talked about? I mean, the pain and the...
I would say so, and In some cases, it's an issue of bone, that there might not be enough bone there to place the implant in. And that's one of the things that we have nowadays is bone grafting, where we can go back and place bone.
Like synthetic materials?
Synthetic materials. Sometimes we move bone from the back part of the mouth to the area where it's needed, so that we've got a bone for where the implant needs to go.
What about a touch of osteoporosis? My mother has osteoporosis. Told me on the way over here that she's too old. You say she's not.
Well, in my view, that's even more of a reason to go ahead and get the dental implant, because that's going to help preserve that bone. If she has osteoporosis, she may be at risk for losing bone more rapidly than someone else. So the implant is even more important for those folks to maintain that bone.
What if somebody says, I have bad gums? In fact, that's why they have to remove all the teeth in the first place. They can still get implants?
Typically, and that's something also that you would need to have a very careful diagnosis of exactly where the bone is, because if they've had gum disease and they've lost some bone, and so that's something that's critical, is to make sure that you've got an adequate place to put the implant into. But as I mentioned, with our bone grafting materials, it doesn't rule out the implant. It just means it maybe takes a couple more steps to get there.
Why do you like this area of dentistry so much?
Well, it is so rewarding for me as a dentist to be able to basically make the patient whole again. Everything we've done in the past with dentistry has been a compromise. If the one tooth is missing, we make a bridge. Well, yeah, we solved that problem, but we sort of introduced 2 or 3 other problems.
Okay.
And with dental implants, it's a one-tooth solution, and it gives you the tooth back, and it is so much like restoring that patient, getting them back to as if the tooth were never lost in the first place. And that to me is so rewarding, to be able to do that and provide that service for patients. And then when you get into the denture wear, that's phenomenally rewarding, because those patients are so appreciative of the impact it makes on their life, because they can go from having all these problems to feeling confident and secure. It changes their life.
Is this one of those things where they say, I wish I did this years ago?
We hear that a lot, and because people have suffered with dentures and not known, the benefits, and so they put it off, thinking, I don't know about this. But once they actually get to that point, they're thrilled.
So, anybody missing a tooth, they go in for a consult. Do they see you?
Yeah, that's the first step. Is we take a look and do an examination. Well, let me back up. The first step is I want to talk about what are the concerns of the patient. What problems are they having? Where are they wanting to go? And that's what I like to do, what I call a patient-centered approach. And by that I mean we want to find out what the patient is concerned about, what problems are they having currently, and what are their goals long term. Where do they want to be in terms of their dental health, say 5 years down the road or 10 years down the road. And then from that we do a thorough exam, find out what the situation is in their mouth, and come up with a game plan so that we can help get that patient where they want to be and solve their problems.
Very good. Thank you. Very interesting. You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again online, visit our website at wellnesshour.com. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news, with your host, Randy Alvarez, the authority on health issues.